Bird flu, also known as avian influenza, is a virus. It primarily affects birds. This virus has been a significant concern for poultry farmers and bird enthusiasts alike, as it can lead to devastating losses in bird populations. The virus spreads rapidly among birds, especially in densely populated areas like farms and aviaries. Wild birds, particularly waterfowl, are natural carriers of the virus and can spread it over long distances during migration. However, it can also infect other animals, including cats. Cats can contract the virus by coming into contact with infected birds or their droppings. This is particularly concerning for outdoor cats who may hunt birds or scavenge in areas where infected birds have been. Indoor cats are not entirely safe either, as the virus can be brought into the home on shoes, clothing, or other objects. While bird flu outbreaks are more common in birds, the potential for feline transmission is a serious concern for cat owners. The symptoms of bird flu in cats can be severe and include respiratory distress, lethargy, and even death. Early detection and treatment are crucial to improving the chances of recovery. Cat owners should be vigilant and seek veterinary care if they notice any unusual symptoms in their pets. Understanding how this virus spreads and its potential impact on cats is crucial. The virus can be transmitted through direct contact with infected birds, their droppings, or contaminated surfaces. It can also spread through the air via respiratory droplets. By knowing the modes of transmission, cat owners can take steps to minimize the risk of infection. This includes keeping cats indoors, practicing good hygiene, and avoiding areas where infected birds may be present. By learning about bird flu, we can take proactive steps to protect our feline companions. Educating ourselves about the symptoms and transmission of the virus is the first step. Regular veterinary checkups and vaccinations can also help keep our cats healthy. Additionally, creating a safe and clean environment for our pets can reduce the risk of infection. Simple measures like washing hands after handling birds or cleaning bird feeders can make a significant difference. We can also help prevent the further spread of this potentially dangerous virus. Public awareness and cooperation are key to controlling bird flu outbreaks. By staying informed and taking responsible actions, we can protect not only our cats but also other animals and ourselves. Together, we can create a safer environment for all our beloved pets and wildlife. Cats can contract bird flu through direct contact with infected birds. This means that if a cat catches or plays with a bird that is carrying the virus, the cat can become infected. The virus can be present in the bird's saliva, nasal secretions, and feces, making any interaction potentially dangerous for the cat. They can also be infected indirectly. This indirect transmission can occur when a cat comes into contact with surfaces or materials that have been contaminated by an infected bird. For example, if a bird with the virus lands on a garden bench or a patch of grass, it can leave behind traces of the virus. Contact with contaminated surfaces or materials is a risk. Cats are naturally curious creatures and often sniff or rub against various objects in their environment. If these objects are contaminated with the virus, the cat can pick it up on its fur or paws and later ingest it while grooming. These materials can include bird droppings, feathers, or even food and water dishes. Bird droppings are particularly hazardous as they can contain high concentrations of the virus. Feathers shed by infected birds can also carry the virus, and if a cat plays with or chews on these feathers, it can become infected. Outdoor cats have a higher risk of exposure. Cats that roam freely outdoors are more likely to encounter infected birds or contaminated environments. They may hunt birds, explore areas where birds have been, or come into contact with other animals that have been exposed to the virus. This is due to their increased likelihood of encountering infected birds or their droppings. Birds often perch in trees, on fences, or on the ground, leaving behind droppings that can contaminate the area. An outdoor cat that frequents these areas is at a higher risk of picking up the virus. However, indoor cats are not entirely safe. While they are less likely to come into direct contact with infected birds, they can still be exposed to the virus through other means. Indoor cats may be at risk if the virus is brought into the home by humans or other pets. The virus can be carried indoors on shoes, clothing, or even other pets. For instance, if a person walks through an area contaminated with bird droppings and then enters the house, they can inadvertently bring the virus inside. Similarly, dogs that go outside and then interact with indoor cats can also be a source of transmission. Recognizing the symptoms of bird flu in cats is vital for early detection and treatment. Bird flu, also known as avian influenza, is a viral infection that primarily affects birds but can also infect other animals, including cats. Understanding the signs and symptoms can help cat owners act quickly to ensure their pets receive the necessary care. Common signs include respiratory distress such as coughing, sneezing, and difficulty breathing. These symptoms are often the first indicators that something is wrong. Cats may exhibit these signs in varying degrees from mild to severe depending on the progression of the illness. Cats may also exhibit lethargy, loss of appetite, fever, and conjunctivitis. Lethargy can manifest as a lack of energy or interest in activities they usually enjoy. Loss of appetite is another red flag, as it can lead to rapid weight loss and further health complications. Fever and conjunctivitis or inflammation of the eyes are additional symptoms that should not be ignored. In severe cases, bird flu can lead to neurological problems. These may include unsteady walking, head tilting, and other signs of nervous system involvement. Such symptoms indicate that the virus has affected the cat's brain and spinal cord, which can be particularly dangerous. Seizures, paralysis, and even death can occur. Seizures are sudden, uncontrolled electrical disturbances in the brain that can cause convulsions and loss of consciousness. Paralysis may affect one or more limbs, making it difficult or impossible for the cat to move. In the most tragic cases, bird flu can be fatal. If you notice any of these symptoms in your cat, it is essential to seek immediate veterinary attention. Early intervention can make a significant difference in the outcome for your pet. A veterinarian can provide a proper diagnosis and recommend the best course of treatment to help your cat recover. Remember, prompt action can save lives. Preventing bird flu in cats starts with minimizing their exposure to potentially infected birds and their droppings. Keep your cat indoors. This significantly reduces the risk of contact with infected birds. Regularly clean and disinfect your cat's litter box. Also, clean food and water dishes. Use a pet-safe disinfectant. Follow the manufacturer's instructions carefully. Section 5. Early detection is crucial. Seeking veterinary care. If you suspect your cat has been exposed to bird flu or shows any symptoms, immediate veterinary care is essential. Early diagnosis and treatment can greatly improve your cat's chances of recovery. Your veterinarian will likely perform a physical exam. They may also recommend diagnostic tests. These tests can include blood work and nasal or throat swabs. Section 6. Navigating the outbreak. A guide for cat owners. Bird flu outbreaks can be a stressful time for cat owners. Staying informed about the situation is crucial. Follow guidelines from local authorities and veterinary professionals. Take precautions to protect your cat. These precautions include keeping them indoors and practicing good hygiene. Remember, early detection and treatment are key to a positive outcome. Section 7. A public health concern protecting both humans and animals. Bird flu is not only a concern for animal health but also for human health. While rare, the virus can spread from birds to humans. Following good hygiene practices is essential for everyone. Wash your hands thoroughly after handling birds or visiting areas where birds congregate. Avoid contact with sick or dead birds. The quest for a solution. Vaccine research and development. Scientists are actively researching vaccines to protect cats from bird flu. While there is currently no commercially available vaccine for cats, research is ongoing. Stay updated on the latest developments in bird flu vaccine research. Consult with your veterinarian about potential preventative measures for your cat. Finding support and information, connecting with others. Dealing with a bird flu outbreak can be isolating. Connecting with other cat owners online can provide valuable support and information. Online forums and social media groups dedicated to cat health can offer a platform to share experiences, ask questions, and stay informed. Remember to rely on credible sources of information such as veterinary professionals and reputable animal health organizations. The importance of expert advice. Veterinarians and virologists. Veterinarians and virologists are valuable resources during bird flu outbreaks. They can provide expert advice on prevention, diagnosis, and treatment. Don't hesitate to reach out to your veterinarian if you have any concerns about your cat's health. They can offer guidance based on the latest scientific evidence and local recommendations. Staying ahead of the curve. Proactive prevention and awareness. Proactive prevention and awareness are crucial in combating bird flu. By staying informed, practicing good hygiene, and seeking veterinary care when needed, we can protect our feline companions and ourselves from this potentially dangerous virus. Remember, knowledge is power. By understanding bird flu and taking appropriate precautions, we can create a safer environment for both cats and humans.